Hi, I'm Lisa Squire, Senior Communications Advisor for Alberta Health Services, and this is Health Matters. Today we're going to be talking with Dr. Bennett, the Medical Officer of Health for Alberta Health Services South Zone, and we're going to be talking about immunizations for school-aged children. So welcome, Dr. Bennett. What are some immunizations that parents should be getting for their school-aged children?
Thank you for having me here. There are two main groups of immunizations. The grade 5 ones, you got two of them. Hepatitis B vaccine. Hepatitis B is a very nasty infection of the liver. It causes chronic disease of the liver, and eventually people end up in liver failure and can die from it. And then there is the HPV vaccine. So this is the vaccine that prevents cervical cancer. Again, nasty, nasty infection. It's one of the top 5 cancers for women in Canada, so it's out there. So that's grade 5. And then for the grade 9 children, we usually give a vaccine that prevents meningitis in children. So meningitis, inflammation of the brain and inflammation of the lining of the brain. Nasty, nasty stuff. You really don't want your children to get it. And then we give a booster for 3 of our vaccines. It's all together in one injection. So there's diphtheria, which is a terrible infection of the throat, can stop breathing, can cause death. There's tetanus, again, nasty, nasty infection linked to getting cut and everything. And then there's pertussis, otherwise known as whooping cough. We all know it's not a pleasant one. So those are the main ones. But during the whole school time, there's also an opportunity for people to catch up on other immunizations their children might have missed as babies. So it's worth asking and getting it done at that time.
And why is it important for parents to make sure that their kids are getting them and that they're up to date?
The thing is, those diseases are still out there. They still kill. Yes, medical science has improved, but those diseases are still out there. And in a community, almost everybody needs to be immunized for that community to be protected. So we talk about the concept of herd immunity, where if less than 95% of the people in a community are not immune, so have not had the disease or have not been vaccinated, then there is a risk that we'll start getting outbreaks of that disease. So that's the thing. And since at the moment, despite medical science, we're still not able to guarantee that everybody will survive these infections, it's best people get protected against them.
And what should parents be doing to make sure that their kids are up to date? You know, sometimes you get consent forms in schools, so...
Yes. So every year, a number of consent forms go out to parents, and some of them come from the public health department. And what we ask is permission to, one, go into your children's immunization record to see what they've had and what they've not had, but also to permission to get your children up to date with their immunizations. So to give them those 4 vaccines that I mentioned earlier, and also to see any other ones they've missed, whether we can get up to date with it. The important thing with the consent forms is whatever you think. So if it's no, you don't want your children to get immunized, or yes, you want your children to get immunized, we need an answer. We need to know. Because if we don't know, then what happens is, one, we misunderstand the situation. So let's say you want your child to get the vaccine. We might well miss out, not give your child the vaccine, and your child misses out. But also, if you'd rather not have the service we're offering, we also want to know, because when we don't get the consent, then we start calling you up, we start sending letters to you. It gets all annoying. But if we know that, you don't wish to have the service, then we don't bother you as much. You don't get all the annoying phone calls and letters from us. And, that's what would really help us all.
And are there other consent forms in school that parents need to be aware of and make sure that they're filling out, like speech language? And
Yes. There are other departments within Alberta Health Services that send out consent forms. Every single one of them, it's part of a provincial plan, and there's something behind why they are sending it. For example, the speech and language therapy one, they send something out asking for consent to check children's hearing, particularly grade 1 and kindergarten. I think it's a good thing, because if the child has a hearing problem, then it makes it difficult for them to learn and all that. So if it's something can be done about it, then they know. So things like that, again, it's your choice as parents. If you don't want it done, those staff will really, really value a yes or a no, so that they know not to contact you if you would rather not have that service. Again, there are other departments. For example, our oral health team, so the ones that take care of the teeth and things around the teeth. They have various programs they have, including putting fluoride vanishes, just giving good health advice about dental hygiene and things. They send a consent form too. Same thing. If you would like the service, good. We want to know that. But if you would not like the service, it's very valuable for these people to know, so that, you know, they don't annoy you by trying to get in touch all the time and you get all the multiple phone messages.
Great. Thank you very much, Dr. Bennett. That's some really great information. I know parents out there want to make sure that they're making good choices and helping to keep their kids healthy, and these tips will definitely help them to do that. I'm Lisa Squires, and this is Health Matters.